Hi, Casey. How are you?
I'm doing okay. It's nice to see you again.
Sure. What's going on today?
Yeah, I came in because I have a couple of things bothering me, to be honest.
Okay.
My scalp has been super itchy lately and just generally uncomfortable. I'm hopeful it's not like lice or anything like that, though, because when I mess with it, I don't like see or feel anything much.
Okay.
It's just like a phantom itching.
Sure. Have you taken a look in the mirror or had someone else take a look in the back?
I haven't been able to have somebody else look. I've just been kind of feeling it with my fingers.
Okay, so you haven't like gone. Okay. So there could be some redness and irritation there.
And then the second thing was my stomach has been bothering me a lot lately.
Okay. When did the symptoms start with both of your head and your stomach?
The stomach was a while ago. I just didn't think, I don't know, sometimes you get like an upset stomach, so I didn't think too much about it until it just wouldn't go away.
Okay.
It started like a month ago. Maybe a month and like 2 weeks.
Okay. What kind of pain is the stomach pain? Is it throbbing? Is it any outward?
It's just like dull and aching. It's not like a sharp pain. It's just like throughout the day I notice it at my desk job. Just like my stomach hurts and I thought like, oh, maybe I have to go to the bathroom, but that's not it.
Okay. Does this happen at any points of the day stronger than others, or is it just...
It's more during the day than at night, because once I'm asleep, it doesn't really bother me.
Okay. All right. And on a scale of 1 to 10 right now, how is it?
Like 4.
It's okay. Have you been taking anything for the pain?
Just over-the-counter stuff.
Okay. All right. Is it working? Like what, Tums?
Yeah,
Pepto-Bismol?
basically, yeah.
Okay.
And not really, honestly.
All right. Okay. And then when did the scalp itching start?
That was more recent. That was like 2 weeks ago.
Okay. And is that persistent throughout the day or at certain times?
It just kind of randomly comes and goes. And every day I wake up expecting it to be gone, but then it eventually comes back.
Okay. All right. Is your stomach tender to the touch?
A little bit. It feels more internal than external,
Okay,
though.
so no redness or things with the skin that you've noticed there. Okay. And on a scale of 1 to 10 with your head right now, what is that pain level? What'd you say?
It's honestly pretty itchy. It's not like painful, though, just itchy. Like discomfort-wise, probably like a 7.
Oh, wow. Okay. Well, I'm definitely going to check that out. Have you had any special changes to your diets?
No.
Okay. Did you travel out of the country in the last 6 to 8 weeks?
No.
Okay. Any medications that you take on a daily basis?
Just my birth control.
Okay. And that's working fine?
Mm-hmm.
Okay. And could you verify your date of birth?
Yep. It's October 12th, 1997.
All right. And any family history of medical issues that I should be aware of?
No.
No. All right. Surgeries in the last year?
No.
Okay. Any major changes in your life? Any stressors, breakups, divorce, moving house?
I'm going through a rough breakup.
Oh, okay. Sorry to hear that. But that could definitely be the cause. Sometimes physiological situations can trigger physical symptoms. So,
Okay.
all right. So first I'm going to check your vitals, and we're going to look at both of your scalp and your abdomen in depth, okay?
Okay, that sounds good.
Okay. So first I'm going to check your heart and your lungs, all right?
Okay.
So if you could just breathe normally for me. Okay. Could you uncross your ankles too? Thanks. Okay. Okay, listen on the bell side. So far, everything's normal. Okay. No S3 or S4. I'm gonna listen to your lungs here. So if I can just get right here. Okay, here, let me go in the back here. Okay, now take a deep breath for me. And out. Good. In. And out. Alright, good. On the other side. Lungs sound healthy. In. And out. In. And out. Very good. Are you a smoker at all?
No.
Okay. That's good. Okay, I'm going to take your blood pressure next. Okay. All right. 110/80, so that's excellent. Okay. Going to check your temperature. .1. Let's do your oxygenation as well. Can I have your index finger? Okay, just relax both hands here. Okay. Your oxygenation is 98% at room air, and heart rate is 80 beats per minute. Okay, go ahead and take this. So I'm just going to do an initial inspection of the hairline and your skin, okay? So just relax here. Just looking for signs of redness or irritation along the hairline. Okay, your skin is well perfused. I don't see any dryness or oversecretion of oil glands. That's good. Okay. Okay, I'm seeing a bit of redness as I go back toward the base of the skull, so that's something I'm going to inspect and have you lay down for, but it's not stemming from the hairline. The skin on your face looks to be completely unaffected. Okay. Seeing a couple red bumps, but those look like normal blemishes. I'm going to go ahead and be palpating your face, okay? So I'll just be feeling just for swelling or any unusual fluid buildup. Let me know if you feel any pain.
Thank you.
Feeling your lymph nodes. They're not palpable, so that's good. Along the jawline, no swelling. Very good. Okay. So no itchiness along the neck?
No.
Okay, and behind the ears?
A tiny bit.
A little bit. What about in front of the ears?
No.
Okay. I'm going to do a couple of neurological tests just to judge your sensitivity on your face and your skin.
Okay.
So the first is a sharp and dull test.
Okay.
And I want you to go ahead and first you can keep your eyes open. Do you feel this as a sharp sensation?
Yeah.
Okay. And do you feel this kind of soft tickle?
Yeah.
So that's going to be dull.
Okay.
So go ahead and close your eyes and whatever you feel, say sharp or dull. Okay?
Gotcha. Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Dull.
All right. And just using the dull tool, let me know which side of your face do you feel it on. So you just need to say left or right, or if it's in the center, go ahead and say that.
Gotcha. Left. Right. Left. 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 Right. Center. Center. Right. Center. Right. Left. Center.
Okay. Everything looks good there. Go ahead and keep your eyes closed. Okay. I'm going to be starting at the center of your face and going out to the edges. I'll be scraping this tool the entire way. I want you to let me know if you feel it all the way or if there is a part where it's more numb.
Gotcha.
So let me know if you feel it equally on both sides.
Yes.
Okay.
Yes.
Okay.
Yes. 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 I felt like a little bit more on the left.
On the left. Okay, so some numbness on the right side. All right.
More on the left.
Okay. So
A little bit more on the left. Both. Both. Both.
okay. Before we lay you down and look at your scalp, I'm going to look in your eyes and ears just to make sure everything is normal there.
Okay.
But so far, so good.
Okay.
Go ahead and look straight ahead for me.
Okay.
Okay, pupils round and reactive. And look on the other side. Okay, no issues there. Have you had any itchiness in the eyes?
No.
At all? Okay, that's good. Okay, I'm looking inside your ears now. So just same thing. Relax. Don't see any redness here. So that's good. No scarring, no scratching. Your tympanic membrane is pearl gray, which is what we want to see. So that's good. I'm going to look in the other ear. Alright. Nice. very healthy tympanic membrane. You have a bit of wax buildup just outside of the membrane. So just something to keep in mind. If you ever have hearing issues on this side, before running to the ear doctor, just try to maybe clean it out and see.
Gotcha.
Okay. So I'm going to have you lay down, and I'm going to be taking an in-depth look at your scalp.
Great.
Okay.
Thank you.
Okay. Let's see. Just going to be doing an initial inspection of the scalp. You could lift your head just a little bit. Thank you. Just need to get this out of your way. All right, lay down. Okay. Sorry. I do see some red patches here, so there's something going on dermatologically. A little bit of flakiness too. And it gets a lot more red as you go to the base of the scalp. So that makes sense with what you're telling me. I'm not seeing any lice. No bed bugs. I'm going to keep looking for them, but right now it doesn't appear to be those kind of bites either. The kind of redness caused by lice is pretty specific, and that's not what I'm seeing, so I think you're good to go there. Okay. I'm going to test your sensitivity to temperature on your scalp just to get a better gauge of what kind of numbness you're experiencing, if any, or if the itchiness is causing a complete numbness of the skull. So this is going to feel like a cold sensation. Do you feel that?
Yeah.
Okay. Do you feel it more when I touch your face with it?
Yeah.
Okay. So part of that's normal. We tend to have a little less sensitivity on our heads than on our faces, but you should be able to differentiate between this sensation and this, which we'll call warm, although it should just feel kind of like nothing. Okay,
Gotcha.
so this will be cold and this will be warm. Just relax and let me know which one you feel, okay?
Thank you. Cold. Cold. Warm. cold, warm, warm, good, cold, 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 warm, 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 okay, cold, 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 warm, cold, okay, cold.
Okay, your acuity to temperature on your that part of the scalp is very proficient, so we're not worried about that. Brushing these sensory tools on either side of the part.
Okay,
I want you to tell me if you feel it on the left or the right side, okay?
gotcha.
All right.
Right, left, right, right, left, left, right, both, right, left, left, right, 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 both.
Okay. Is this sharp or is this dull?
Sharp,
Okay. How about this?
sharp, dull, dull, dull.
Okay. Good. That's right. I'm going to inspect just a different part of the scalp here. Smoothing out the hair so I can see a little better. Inspecting the skin here. Alright. Same here with the red patches. Have you changed shampoos or conditioners lately? Any new hairsprays?
No.
Okay. Looks like an allergic reaction, so that's why I ask.
Okay.
So. By chance, have you had any changes in pillowcases?
You know, I started sleeping with a satin bonnet thing to
Okay.
help protect my hair when I sleep.
Sure. I know exactly what you're talking about, and those are usually harmless. Very rarely there can be an allergic reaction to that. So after this, I'm going to ask that you just spend a week without it, just to see.
Okay.
I'm going to be applying some ointment to your scalp,
Great.
just to maybe jumpstart the process and treat it as if it's an allergic reaction. We'll go from there, but I'd like to do some more sensitivity tests here along this part.
Okay.
Okay, so we're going to do warm or cold again. This is warm. This is cold. Okay, go ahead and say warm or cold.
Gotcha.
Cold. Good.
Warm. Warm. Cold. 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 Warm.
Okay.
Warm. Warm.
Now, as I bring this implement from the base of your skull to your forehead, I want you to let me know if you feel it all the way. So just say yes or no. Okay.
Okay. Yes.
Again.
All the way.
Okay, good.
All the way. All the way. All the way.
All right. This will be cold. And this will be crinkle. So go ahead and say cold or crinkle.
Okay. Cold. Crinkle. Crinkle. Cold. Cold. Crinkle. Crinkle. Cold. Cold. Crinkle. Cold. Cold. Crinkle.
Okay. Alright. And same thing with these sensory brushes. You're going to let me know if you feel it on the left or the right side of the part or both.
Okay.
Okay. right, left, right, right, left, both, both, both. Okay. Crinkle. Both. Both. Right. Right. Left. Both. Both. Okay, and please. All right. We're gonna do a sharp or dull test. Did you feel that sensation? Yeah. Was it sharp or dull? It felt dull. Good. And sharp. Was that dull again? Yes. Dull. Sharp. 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 Dull. Dull. Sharp. 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 Good. Just a few more. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Okay. You don't have any allergies that you know of to topical ointments? Not that I know of. So I'm going to apply some very natural topical treatment to your skull, to your head and scalp. This should alleviate some of the redness. Okay, we're treating this as if you have irritation and an allergic reaction. Okay. To the satin that you've been using. You should feel cold and you should start to feel relief right away. Oh, that feels nice. I'm going to send you home with a prescription of this. Just going to apply it to areas of the scalp. When you get home, I want you to apply this to your entire scalp every 4 to 6 hours. Okay. Excellent. Okay. So, I'm going to go ahead and look at your stomach next. Okay? Okay. All right. How's your scalp feeling? So much better. A little better? Oh my gosh. Okay, that's good. I think that we're headed in the right direction. Good. All right. So, Kate, see, with your permission, I'm just going to lift your shirt just a little bit. Yes, thank you. And lower your pants just so I can get a good assessment of the stomach. Okay. Don't see any initial irritation skin-wise, so I think you're right that it is an internal issue. Okay. Okay, I'm going to take a listen. This is going to feel a little cold, okay? So apologies for that. Okay. No abnormal regurgitation sounds. Healthy digestion. Okay, when I go a bit lower, I'm hearing a bit of irritation. In the lower digestional tract, I'm hearing a lot of acidity build up. What I'm thinking right now, Kate C, is that you may be allergic to some food as well. It could be the bonnet that you said you were sleeping in, but also certain allergies that maybe sometimes as we age, we become allergic to certain foods that maybe we tolerated before. It can happen quite quickly.
Okay.
It definitely happened to me with wheat.
Oh.
And so this could be causing a digestional problem in your stomach and also causing the scalp allergy.
Okay.
So if these two things are connected, then it's definitely a diet allergy.
Okay.
Another theory is that your stomach issues could just be stress,
Okay.
and your scalp issue could be from your sleeping cap.
Okay.
So, okay. I'm going to do some percussions on your stomach.
Okay.
Okay, normal sounds here. I'm not feeling any intense edema. I'm going to palpate your stomach, okay? So you'll be feeling some pressure. I'm just feeling the sides of your organs, your liver, your spleen, your uterus.
Okay.
Okay, so let me know if you feel any intense pain, but it should just feel like a pressure.
Gotcha.
Okay. Feels normal. Okay. I'm gonna go a little bit lower so I can feel the lymph nodes on your in your pelvis. Okay. Non-palpable on the right. Non-palpable on the left, so that's good. So you're not having any organ inflammation. Just going to do a few measurements just to make sure that you have symmetry here along the lining. 4 inches. That's fine. 4.5. Within normal range. Okay. 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 Not seeing anything outward that's a problem. Just going to do one neurological test on your stomach. Just to make sure you don't have loss of sensitivity. It's a sharp and dull test, just like before.
Okay.
This is dull. This is sharp. Let me know which one you feel. Close your eyes.
Sharp. Dull. dull, 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 sharp, 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 dull, 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 sharp, 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 dull.
Okay. So I'm gonna have you just get up and get ready to go on your own time. I'd like to order an allergy test for you, which we can schedule for later this week to rule out any concerns with food or diet.
Okay.
Okay. I also want you to stop wearing that bonnet for the next 2 weeks, just to give it some time to see what happens with that.
Okay.
We're going to monitor your progress. I'm going to give you a follow-up call in a couple days about that. And I'm also going to send you home with that treatment that I applied to your head just to soothe the area and aid with healing.
Thank you so much, Dr.
Okay,
Katie.
but other than that, you're healthy, your vitals are great, and I think that this is definitely going to be a blip, a minor issue. Okay, but thanks for coming in.
Thank you so much for seeing me today.
Okay.
Bye-bye.